I'm going to be speaking to you, as Lachlan mentioned, on the cultural and psychological implications of sexual assault and rape for refugee women, and about working with disclosure, shame, and guilt. As the words on the title suggests, this is going to be a difficult session in terms of it could trigger certain emotions amongst people who are listening to this presentation. So if at any time you would like to take a break, please feel free to exit the discussion and then rejoin us. It's perfectly okay. And if you still would like to discuss with somebody after the presentation, please feel free to reach out to one of the numbers that we will be providing with you at the end of the session. Thank you. And I would also like to begin with an acknowledgement of country. I acknowledge the traditional owners of this land and pay my respects to elders past and present. I join you all from the lands of the Wurundjeri people, and I wish to pay my deep respect to the First Nations people on whose land we live and work on. I would also like to pay my acknowledgement of victims and survivors. We acknowledge the strength and resilience of adults, children, and young people who have experienced family, domestic, and sexual violence, and recognize that it is essential that responses to violence are informed by their experiences and advocacy. We pay our respects to those who did not survive and acknowledge friends and family members who have lost loved ones to this preventable issue. I'm aware that there is a broad cross-section of people here today in the audience, and some of you may know some of the statistics and the background, but not everyone might know this. So I am going to begin with a broad overview of the topic itself of sexual violence against refugees. Of course, we know that rape and other forms of sexual violence against refugees and anyone else in the community is a violation of basic human rights. It is a global public health issue, and it's one of the most serious issues that refugees experience. Women are particularly at risk, and both during flight from their situation, but also when they are refugees. So it can happen at any time during their departure from the situation, the event, whether it's war or another situation, but also after they have been granted refugee status. Usually what we know is that in the country of refuge, women are targeted because of their status as women, and either because of their actual or perceived political and ethnic affiliations. We know that rape is used as a weapon of war, and women are targeted because they are perceived also as to be more vulnerable than others. We also know that children are targeted, also older adults, people who are disabled, and people who may identify differently in terms of their sexual or gender identity. With regard to male refugees, very little is known about the rates of sexual violence. What we do know is that it does occur in the context of detention and torture. And of course, for women as well, it does occur in these contexts of detention and torture. And we have some more information, but we really don't have the full picture of the rate, so the statistics of all of the rates of violence and the types of violence that women refugees and male refugees experience. What we do know is, for some research that's been conducted in 2020, that then of the world's displaced population of 82 million people, there were around 50 to 88% of them who had experienced sexual violence and rape. Currently, the number of displaced people in this world are 110 million people. And of course, this number is only growing all the time because of the several wars that are going on and the conflicts that are going on across the world. So if we can just take a moment to reflect on the magnitude of the problem that we are discussing today. I want you to just reflect on the different kinds of wars that are currently ongoing and that have been for a number of years as well. Some that started out in 1921, others in 1948, and others more recently. So we currently have people who have been killed in the numbers of greater than 10,000 from the Myanmar conflict, from the Arab-Israeli conflict that is currently exacerbated by the Israeli-Palestinian conflict. We have the insurgency in Maghreb going on. We have the Russian-Ukrainian war and the war in Sudan. And this is where more than 10,000 people are killed. And yet we really don't have the figures of the number of refugee women who have been assaulted sexually. When we think of the magnitude of other wars and the way they've been categorized is based on the numbers of people who've been killed, anywhere between 1,000 and 10,000 people. We have the Colombian conflict going on, the Afghan conflict, the Somali civil war, the communal conflicts in Nigeria, the conflict in Iraq, the insurgency in the Khyber region, the Kivu conflict that's in the Democratic Republic of Congo. We have the Mexican drug war going on, the Sudanese nomadic conflicts, the Boko Haram insurgency, the Syrian civil war, the Yemeni civil war, the Ethiopian conflict, and the gang wars in Haiti. I'm outlining these different wars and the numbers of people who've been killed, because if we think of the numbers of people who've been killed and the different wars and conflicts that are currently still ongoing, and as you saw, they are spread across a whole range of regions, but they are also focused on mainly the developing regions of the world. We don't have the numbers, as I said, of the numbers of refugee women who have been sexually assaulted. But if we can just take a moment to think about what is currently going on across the world, because we know from the previous statistics that when the world's displaced population has been affected and when there have been almost 50% of the people have been women, around 50 to 88% of them have been raped or have experienced other forms of sexual violence. So many thousands of women currently are going through these extreme forms of torture. Let us take a moment to reflect on what the impacts of those forms of torture might be for those women, for their families, the communities, and for their ongoing well-being. We know through all of the research that the impacts of sexual violence is ongoing and it can be long-lasting. We have to prepare ourselves for assisting the women who are currently also going through sexual violence in the years to come. What we do know from the statistics in terms of the help-seeking behavior is that, and it is in relation to the women who've been affected by sexual violence or physical violence, we know that less than 40% of women actually seek help, and that is from any source. And lesser than this 40% actually seek help from formal services. So again, for you to understand the magnitude of the issue around the world, and then to think of how many people might actually approach you in your different roles and capacities, and how many you might be able to assist. What I'm trying to ask you to imagine is the number of people who may also never seek help, and how can we encourage them then to seek help? So let's have a look at whether there are system support available. There are guidelines available from across the world. We know that the UNHCR office has developed guidelines on the protection of refugee women and the sexual violence against refugees and guidelines on prevention and response. And these guidelines were not available very early on because I guess they really didn't know how to manage the problem, but also the magnitude of the issue. So these guidelines have been informed by events in Southeast Asia, Yugoslavia, Kenya, and Rwanda. And these guidelines are really a guide to providing preventative measures, but also remedial measures to address sexual violence. However, when we look at the implementation of these guidelines and principles, we know that the implementation mechanisms are lacking. So why might they be lacking? What we do know through research and some of the reports available from the UNHCR office is that there is overall a limited number of UNHCR staff, and especially staff who are then knowledgeable about the guidelines, but also then the relief workers who might be temporary relief workers. They are trying to manage the exodus of people from different countries and meeting their other kinds of basic needs, such as food and shelter. And so the violence that women experience have almost become secondary in nature in terms of the assistance that they are able to offer. So we know that there's limited monitoring on the rates of violence, and that's why we don't have the full picture. But also what we know is that in spite of these guidelines, there's no real mechanism to support the trigger of a systematic response by trained professionals in refugee camps and other places where women might be gathering. So we know that they're at risk. We know that there are principles available, and yet there are almost no implications as well for people who might commit these offenses, because we know that the war-torn areas and refugee camps have lawlessness and the people have impunity. So this is where, although on paper and on across different systems, it appears that there is system support available. However, the implementation is really lacking, and this is what we need to understand as well. So when the implementation mechanisms are lacking, we have to understand that it's probably very difficult for anyone who's gone through sexual assault and rape to actually report the violence. One of the main perceptions across the world, across different communities, is the perception that any form of sexual assault or rape or torture is a private matter. So it should not be reported to anyone. They should not be discussing that and therefore not seek help for it. As I've been mentioning, again, there are limited mechanisms to actually even record the data, but also to report it. So if there's no reporting, no one is there to record the data. The women who do experience the violence, we know that they have limited options of where to go and actually report the violence and the assault. They are also quite aware that rapes are aimed at demoralizing and destroying the social fabric of refugee settlements. So when women know this, they do not want to report it because that then acknowledges that their communities are being destroyed. You see, even in the context of their own personal violation, the women are thinking more broadly in terms of the collective understanding and the collective protection of their communities. So this is where, even when they need the help, they are not reporting it for fear of other repercussions for their community members. We also know through research and some of the statistics available that the offenders in many cases are the authorities. So if they're the people there to actually protect them, who can the refugee women actually go to and report the violence. What they also know is that the odds of convicting perpetrators are very minimal. It's because, again, of the lack of legal mechanisms to protect the women, the actual presence of courts and other forms of systems of protection for the women. When there are courts available, what the findings show is that the women have to travel very long distances to their nearest court. So the women are more, of course, concerned about their personal safety, their well-being, their community safety, and if they have children, their children's safety, and they might not have this as a priority to actually take up the issue and report the violence. What they might feel comfortable doing is if they were able to report the violence to women police officers. However, what we know, in many refugee camps, there are limited numbers of women police officers. So women don't feel comfortable reporting it to male police officers. And then, of course, there's the community attitudes to rape and sexual assault, which I'll be going through in detail. They prevent women reporting sexual assault and rape. And it also relates to the cultural norms and the sense of shame and guilt that the women experience and feel. So what do we know about help-seeking behavior? Help-seeking behavior is usually trying to gain any form of assistance, either formally or informally. And informal sources could be the immediate family, friends, religious groups, community groups. The formal services, on the other hand, are, of course, formally established services where there are trained professionals to assist people who need the help. We know through our research that formal services play a critical role in providing women with the resources, the knowledge, the skills, and the opportunity to promote women's safety and well-being. However, please keep in mind that the help-seeking behavior itself might be absent and might be impacted based on the cultural norms and the cultural background of individuals. When we've just been reflecting on where the wars are occurring and the cultural norms in those countries of origin, what we do know is that the cultural norms actually prevent formal service engagement. And what we found through qualitative metasynthesis that we conducted, wherein we reviewed all the existing literature about looking at which cultural norms might actually affect formal service engagement among survivors of intimate partner violence, what we found is that there are 5 broad categories of themes that actually impact on the formal service engagement. So again, for people who are listening today who are engaged in formal services, please be aware that these aspects could actually impact on people's engagement with you. That is, their gender roles and social expectations. So for example, what is the expected gender role in those communities where the women are coming from? Is it that women have to actually tolerate sexual assault, sexual violence, and that the man might have a right in terms of the rape that they commit? We know in many countries that marital rape is not recognized. It's actually permissible by law. So when they come to a country like Australia, wherein this is not permitted by law, you see, it's very difficult for women to understand what the laws are here and how it might apply to them, but also then the conflict for them of trying to go with the law here and seek protection, but trying to also be understanding of what the expectations are from their community. So this is where the gender roles and social expectations, they carry with them no matter where they go. So we have to be understanding of that. We also have to understand the community recognition and acceptance of abuse. people from a lot of countries, and especially groups of refugees who might be moving across countries, they might accept that it is the norm that when people are refugees, that they might be abused, and therefore that they have to accept it. Of course, we know that that is not acceptable in terms of any abuse at all. However, they might believe that this is what they might need to succumb to. So therefore, we need to understand again their background of how they're accepting abuse, but also the other community members. And therefore, would they actually encourage anyone else that they might know who's gone through abuse to actually engage formally? We also know that people who come from honor-based societies may be limited in their engagement with formal services. We know that religion can play a role as well, wherein people, if they have strong religious backgrounds, and especially if the religious beliefs prevent them from having any extramarital sex or premarital sex, then they are not going to report it to any kind of agency. We also know that the cultural beliefs and attitudes of people who've experienced abuse and their attitudes towards formal services might impact on their engagement. So they might believe that, again, it's a private matter and that they should not be reporting it to formal services. When they have reported it, what we know through research, and it comes up repeatedly, this finding, is that they do not believe that services are operating using a culturally relevant framework. They believe that they need to actually train practitioners on their cultural background and beliefs. And so if women feel that they are not receiving the services based on their cultural expectations, they stop engaging with services. So these are all the challenges amongst minority ethnic communities. This then, of course, relates to disclosure. So if they don't feel that they are going to be helped or that it is a private matter, they might really not seek assistance. What we do know through our research is that women, especially from minority ethnic communities, disclose abuse mainly when they need emergency assistance or their children are affected. So disclosure, again, as we've gone through, is affected by cultural norms and community attitudes. We know that people also do not want to be labeled. So if, for example, somebody does go and seek formal assistance, it could also be self-labeling that they are a rape survivor. They might not want to acknowledge that. They might not want the rest of the community to acknowledge that. So we need to be quite cautious in how people feel about this. We know that they could also be ostracized by the broader community. There's also further repercussions in terms of family disintegration because the family, again, does not expect them to go and report on a private matter. There's further stigmatization and also an attack by other perpetrators and community members because of their past experience of sexual violence. People might also not report it because of their inability to speak the local language. So again, you can see various challenges here with regard to disclosure. And then if we move into the concept of shame and guilt, what we do know is that shame follows a pattern of perceived self-failure. Now, we absolutely understand that when one experiences sexual violence, it is not their fault in any way at all. However, through all of the research that exists and the United Nations reports that are available, we know that people feel a sense of perceived self-failure, that they feel the sense of helplessness, and they feel, of course, a sense of indignity about what they've suffered, and they feel a sense of guilt. And all of this, we know through research again, is associated with avoidant emotion regulation techniques and psychopathology. So they might avoid seeking help, but also then just avoid the fact that they might be a survivor of rape or torture. And when they avoid this, we know that it relates to or it leads to psychopathology. So especially in relation to their feelings of depression, anxiety, and it's also related the extent to which the psychopathological symptoms develop are associated with their prior emotional dysregulation, any strict religious background that they come from, and this sense of guilt. Other research also shows that external shame is a higher risk for psychopathology than internal shame. So this is when the external community members and the large community is shaming them, is talking about rape and violence in a negative way, that has a higher risk for depression and anxiety compared to the internal sense of shame. What is a wonderful mediator that we know through all of this research is that self-compassion activates the soothing emotional regulation system. So it is a wonderful mediator in reducing that sense of shame and actually recalibrating what has happened to them and having a sense of optimism in life. So we know that it can reduce the psychopathological symptoms. So really, we should be focusing on assisting refugee women to have a greater sense of self-compassion. And self-compassion comes through self-kindness, that is being kind to themselves, understanding what has happened to themselves is because of no fault of their own, and they should not be self-critical. They should really be educated about what has happened to them is wrong, and that in fact they are not to be blamed for anything, and that they should not be feeling guilty about this. So here are some practitioner strategies for how to manage all of the challenges in relation to the disclosure of rape and sexual assault, but also trying to understand how shame and guilt feelings might be prevalent amongst this community of women and what we can do about it. So of course, being aware, and I think all of you attending today, you'll are understanding, and I'm sure even through your practice, you'll have already understood that there are lots of challenges with regard to disclosure of rape and sexual assault. We need to understand the help-seeking behavior of people from minority ethnic communities. We need to, of course, know the role of formal and informal support systems. So people might not be ready to engage with the formal support system, but they may be engaging informally. So what can we do then to actually work with those informal support systems so that they can then refer them to you? We, of course, need to look at the action plan that is available from the UNHCR office. And they suggest that we need to listen to the victim, avoid re-traumatization. So we hope that systems operate in such a way that women don't have to repeat their story and their experiences and their feelings to different practitioners and different services. We need to focus on their safety, their rights, their well-being. What are their needs, their expressed needs, and their choices? And of course, we need to provide the services in an empathetic way, and all of this being done in a non-judgmental manner. We need to apply a culturally relevant framework, and we need to also understand that it's not one culturally relevant framework that we need to adopt, but really we need to understand that there are lots of major and minor ethnic groups, because even from within one country, we know through the different wars that are going on that there are minority and majority ethnic groups and communities. So we need to understand the relationship between those communities, what might be happening there. So really having a greater political understanding of what's happening around the world. And we really need to be adopting a trauma, violence, and a culturally informed approach to our practice. For the broader intervention, for the broader community intervention strategies, there is a responsibility of the broader community as well to do something about the issues. Yes, it's individual practitioners who are working intensely, but how about the broader community? We need to ensure that we establish rapport and better relationships with different multicultural community groups, because we know through research that the refugee women and people from minority ethnic backgrounds are reaching out to those informal support groups. So if the formal services can establish that rapport and relationship, that's when there can be that formal referral from them to your practice. We need to promote the availability of formal services to support victim survivors. A lot of the time, women are not aware that there is help available. We need to promote that there is help available in multiple languages as well. We know that in Australia, people speak over 200 languages. And so we need to do a better job of promoting the information. And, even during our webinars and other kinds of presentations, we can now use live AI to actually translate the information in live time into other languages. So let's use those mechanisms as well. We need to ensure that community attitudes to sexual, family, and domestic violence change. It is a difficult thing. These changing community attitudes is almost one of the most challenging things because community attitudes are ingrained. However, it is possible, and we've been currently testing ways of how we can engage with different communities who've gone through different types of violence to actually change their attitudes, and the broader community who have not gone through violence as well, but how they can support others in the community who do decide to take action and engage in the formal services or with formal services. We need to reduce the discrimination of victim survivors of sexual violence through explicit advocacy and active strategies. We need to ensure that they don't feel marginalized, that they're not labeled. So we need to do this in an explicit way so that, again, they feel like what's happened to them is no fault of their own. They're not going to be labeled. And in fact, there is support available. Absolutely, we need to increase the formal help-seeking behavior because, again, it's going to be provided by trained professionals and also those who adopt a trauma, violence, and culturally informed approach. We also need to change community attitudes to mental health help-seeking. We know, again, through research that the mental health help-seeking behavior amongst migrant and refugee communities is limited. Counseling is a very Western form of intervention. So we need to understand what counseling means to them, how it might not be relevant, but how can we support them to still engage in the counseling process. And at a more broader level, all of us who are interested in making a difference, we need to engage with governments as key partners to lead risk mitigation strategies even when there is conflict. We hope that there would not be conflict or war across the world. We know through evidence, though, that it's continuing for several decades. So we need to look at what prevention mechanisms can be adopted and what response strategies can be adopted so that we can reduce and eliminate all forms of sexual violence and rape amongst refugee women and all other people in the community. Thank you so much for listening, and I'm happy to take questions whenever the team is ready to take the questions.